rural health care is suffering. Rural health care has been neglected. We are having a difficult time distributing health care into the rural areas, and imaging and access to imaging, access to primary care is absolutely essential.
Medicine is different in rural areas, and so we're seeing a lower utilization rate both in rural and urban areas that isn't close to the type of utilization rate we're seeing and being recommended by the administration, and a 75% increase here in the House.
The typical rural imaging center uses their equipment about 50% of the time. The proposal that this we would ramp up utilization expectations to 95% of the time, that this equipment would be used 95% of the time, will drive even further imaging centers out of business. They're just not going to be able to provide that service.
If we lose imaging in our rural communities, then not only will we lose our ability to do the kind of high-end treatment planning that we currently can do in radiation therapy, but we'll also end up subjecting these patients perhaps to invasive procedures like surgeries, like catheter-based kinds of invasive procedures that may or may not benefit them because we have not been adequately able to assess their extent of disease before we start treating them.
It's important to maintain funding for this to be able to move forward too, because the direction that we see nuclear medicine and molecular imaging going is to assess response to therapy very early after treatment. And I see in the next few years, this is where the field is going. It's going to allow us to tell whether a treatment's working within days after it started. And if it's not, then another treatment's used. PET scans are used at multiple sites throughout rural Iowa, as well as at big medical centers like at the University of Iowa. And we see those studies regularly. And the quality of those studies is actually remarkably good. It isn't quite exactly the same as we do at the university, but it's very good studies that are being done out there. And if those are lost because of the change in the reimbursement, it's going to it's going to cause significant delays or inappropriate treatments in patients.
In some of our rural communities, the bookmobile comes through there more than the mobile mammography unit. So we have a community that 2 times a year, women are able to get a mammogram. And that's it, unless they can afford to travel out of that community. So it's so important that we really look at what impact that these decisions would have on our rural partners. I think we need to walk a fine line when we're looking at what services and access to care we really want to give up. You know I want the best for me, and I want the best for my family, and I know you all in here would agree with that. So let's be cautious when we're making those decisions on what do we cut, and think about what the ramification is.
Most of us in rural America are already being reimbursed less than urban areas. So when you get this arbitrary flat rate cut, it affects us even more because our initial payment for an imaging study, a treatment study, is already less in states like Iowa and Nebraska and Arkansas than it is in metropolitan New York City.
Imaging technology has advanced so much that now we can diagnose lung cancer at extremely early stage. Let me show you the difference. This is what a chest X-ray misses. This is the mean size of a tumor that the chest X-ray cannot pick up. This is what a CT scan can pick up. If you're at high risk for lung cancer, you have a family member, you used to smoke, You were exposed to Agent Orange. You were exposed to asbestos. Do you want a CT scan or do you want a chest x-ray? And that's what it comes down to. If we can get it caught early, you're not only going to save lives, you're going to reduce costs tremendously. Imaging is not the problem, it's the answer.
Quality imaging saves lives, and that's why we've got the mantra that this organization has, that we want, you know, the right image at the right time. And my question to all of you would be, shouldn't all Americans have equal access to health care, not, you know, have a disadvantage if you live in a rural area?
I'm particularly amazed at this, in a sense, push towards a 95% utilization rate. What that implies is a huge backlog at most of the imaging centers. And for instance, this waiting 5 hours for an MR on successive days, this is what it takes if you're going to be able to keep the patients coming in and utilizing the machine at a 95% level. That really is not the optimal level for patient care. 50% may not be the optimum level, but it's not clear quite what it is, but it sure isn't 95%. And I make very sure that we're not running at that level, and I wouldn't want to run at that level with our machines. Yeah.
We can all live with a scientific, objective approach to this issue of how much equipment is utilized. But what we can't live with are arbitrary, whimsical decisions that have no scientific basis that might hurt our patients in rural areas.